Good evening and welcome to everyone. I'm Andrew Harris. I'm Director of Campaigns and Alumni Relations at the university, and I'd like to welcome you all to the latest session in the Bright Minds webinar series. So this webinar series, as many of you will know, has been created for our alumni and friends, really to showcase the varied, the exciting and the truly impactful research that is taking place at your university and largely through the work of our young academics. So it's wonderful to see so many of our alumni joining us today, genuinely from all over the world. We've had, I think, alumni from about 58 countries sign up to this particular event. Today, our topic is food security, and we are taking this evening from a social sciences perspective. So what with the challenging geopolitical situation and the effects that this is having on the global supply chains, also with a changing climate, rising food prices, and the equitable access to health and affordable food being an issue, this subject really is never more topical, I think, than now. And this is a really big area of work from the university. So I hope you'll be looking forward to hearing from our PhD student, Bettina, and also from Professor Peter Jackson. So Peter is co-director of the Institute for Sustainable Food and Professor of Geography at the university. The Institute for Sustainable Food is one of the 4 flagship research institutes of the university. And when I stop talking, I'll drop a link in to the chat so you can actually take a look at those 4 flagship institutes. So today we'll begin with a short introduction from Peter. Peter will hand then over to Bettina for her presentation. And as the talks progress, you'll have the opportunity to put questions in the chat. So before I get started, just a few housekeeping items. So really to allow participants to have the best viewing experience, we have automatically turned off your microphones and cameras. But if you would like to submit a question, please do put it in the chat box it is in the bar beneath. After the presentation, Peter and Bettina will answer as many of the questions as we have time for, and we have had some pre-submitted questions from our alumni in advance. And again, we'll go through as many of those as we are able to. So we are recording this webinar, and it will be available on the Bright Minds web pages probably next week, and we'll send out a link so that you can access this again. So without further ado, very delighted to hand over to Professor Peter Jackson. Peter.
Thank you, Andrew. Yes, I'm Peter Jackson, and it's my pleasure as one of her PhD supervisors to introduce Bettina Zenz, our speaker tonight. We're delighted by the interest in this talk from our alumni. We have over 120 participants on the call, including, I think, some of my own previous students. So welcome to you all. As Andrew said, Bettina is a PhD student here at the University of Sheffield in our Grantham Centre for Sustainable Futures. And one of the things the Grantham Centre does to encourage interdisciplinary discussion of important questions of social and environmental sustainability is to make sure that our PhD students have at least 2 supervisors, always from different departments and often from different faculties across the university. So in Bettina's case, her supervisors are Professor Barry Gibson from the Dental School in the Faculty of Medicine, Dentistry and Health, and me, a geographer in the Faculty of Social Sciences. And in Bettina's case, she has a 3rd supervisor, Professor Rahul Naidu from the University of Trinidad, where Bettina is hoping to do some fieldwork next year. My interest in this project is in terms of the links between food, health and sustainability. As Andrew said, I'm one of 2 co-directors of the Institute for Sustainable Food, which is one of the university's flagship research institutes. The others focus on energy, neuroscience and health across the lifespan. I'm also leading the H3 project, which stands for Healthy Soil, Healthy Food, Healthy People, part of a large research programme that aims to transform the UK's food system. But tonight's not about me, it's about Bettina, and she's going to present now on the relationship between sugar consumption and health inequalities. She'll speak for about 20 minutes, and then, as Andrew said, we'll try and answer as many of your questions as we can, some submitted in advance, but we'll also be keeping our eyes on the chat function to see if there are any live questions that we can accommodate as well. So Bettina, the floor is yours.
Hi everyone. Thank you, Peter and Andrew, for the introduction. It's really nice to be here today. So I've started my PhD at the end of 2019, and obviously we didn't know, like nobody knew that COVID was just around the corner. So as a result of that, I haven't really had many opportunities to talk about my research with a wider audience. So it's really nice to be here today and to be able to do that. I'm gonna start sharing my screen with you. I hope this works and that you can all see my slide. So my PhD looks at the topic of sugar consumption, largely within the context of soft drinks or sugar-sweetened beverages. But I'm also very interested in the topic of health inequalities. So the PhD is pulling those two areas together, and where the PhD looks at the context of Trinidad and Tobago, which is a beautiful spot in the Caribbean, which also happens to have the highest sugar intake rates in the world. Today I'm going to talk about the issues of sugar consumption and inequality within a more generalized context within the UK. So sugar, why sugar? Sugar intake and how much sugar is too much for us are hot topics at the moment. We hear a lot about different pieces of advice. Often advice from the food industry can be quite different compared to public health advice. But sugar is also a very personal topic to people. So whenever I find myself talking to people, anybody, about my project and mentioning that it's about sugar, then often without much prompting, people will start telling me about their own sugar intake habits. So how much they have in a day, why they have it, and how good or bad they think it is. So I've heard quite a lot of anecdotal evidence over the last couple of years, which has been interesting for all sorts of reasons. But sugar is also part of our daily life. It's part of our history. So going back to colonial times and all the way through time, through the Industrial Revolution, when a lot has changed with regards to how we eat, where our food comes from and what it is made of. And ever since then, we have started to consume an increasing amount of sugar, often without realizing that the food that we eat is actually not sweet. So even savory dishes, especially if they've been processed, contain a lot more sugar than we think. And in light of this, our diets have often, without realizing, started to contain more sugar, and we've started to receive different pieces of advice telling us how much is too much or how much we should cut down on. But it can be quite difficult to filter through all these different pieces of advice. So if we look at what the World Health Organization recommends, we are being advised that if we reduce our sugar intake to less than 10% in a day of our total energy, then we reduce the risk of becoming obese, of becoming overweight, or of developing possibly dental health conditions. Even better, if we can, we're being advised to reduce our sugar intake to less than 5% in a day. And 5% roughly equates to about 25 grams or 6 teaspoons of sugar. And doing so, it is advised, would help us to gain additional health benefits and reduce some of those chronic conditions that can happen as a result of unhealthy diets. Now, 5% of sugar in a day is not a lot, and I'm going to show you just how little it actually equates to. So if you were trying to stick to these guidelines, you would be able to choose only one of the images on the screen here, and that would be your daily recommended sugar allowance. And I mean, without sounding too presumptuous, that is really quite hard to do, certainly on a daily basis. And it turns out I'm not the only one who thinks it is quite difficult to stick to this particular guideline, because the average person in the UK consumes about 20 teaspoons of sugar in a day. And these mainly come from sources such as soft drinks, sugar, biscuits, confectionery, but also ultra-processed foods. And we can have a look at this slide here, which shows us how unequal sugar consumption is shared between different age groups. So often the data shows that teenagers tend to be the largest consumers of sugar in a day, largely to do with soft drinks, followed by slightly older children and then adults of different ages, whereas young children up to the age of 3 tend to consume the least. The main contributor of people's daily sugar intake often is to do with soft drinks, also abbreviated with the catchy phrase sugar sweetened beverages, or SSBs. And they make up, so I've got a personal interest in them because they make up the most, sort of the main body of the PhD. This is the largest context of sugar that I look at as part of my studies. And by soft drinks, what I mean is all regular soft drinks. So nothing, no diet products or no diet Coke or so on, just the regular ones that you'd find in the shop, your Coke and Sprite and Fanta and so on, as well as cordials and sports drinks. And the problem with soft drinks is that they have a very high sugar content, and as a result of this are easily overconsumed. The problem is that they also contain very little or no nutritional benefit to health at all. And over time, if you're looking back some decades, our soft drink consumption has increased steadily, and compared to the 1950s, we now consume about 5 times as many as we used to. It's very easy to see how quickly soft drinks can push us over anything resembling a daily sugar allowance. So especially if you look at the right-hand side of this table, you can see 3 different Fantas and a Schweppes. They contain all more than 40 grams of sugar in a can, so that's quite a lot. You can see the teaspoons there as well. So it's easy to see how quickly it can happen that we consume a lot more sugar than we realize, especially if they're cool. It often doesn't taste as sweet as it actually is. So knowing what we know about sugar and how easy it is to overconsume, let's have a quick look at what health implications there are if we do consume too much. So health conditions with regards to diet are often discussed within the context of chronic diseases or non-communicable diseases. These conditions are not infectious or contagious, but instead they develop gradually in a person's body over the course of their lifetime, usually as a result of either lifestyle and or genetic factors that contribute to their development. They contain a huge number of different conditions and diseases now, but chief among them are heart conditions, including strokes, diabetes, chronic lung conditions, as well as various types of cancer, and also lots of dental health issues. So dental caries, tooth erosion, and so on. They have become one of the biggest health and developmental challenges now for public health. And it's easy to see why, because they cause nearly 3/4 of all deaths in the world now, which roughly equates to about 41 million people every year. And there's a new statistic which has been published recently by the WHO, which reports that every couple of seconds, a person under the age of 70 dies because of having developed an NCD. They're also really expensive. So as a result of people having to leave work prematurely, they do cost governments a huge amount of money. And it is believed that if things stay the same as they are, so if non-communicable diseases develop on path as they are at the moment, then in about 8 years' time, and they could cost the global economy somewhere around $47 trillion by the year 2030. So very expensive. And another very important factor about them is that they don't affect people equally in society. So this is part of the health inequalities angle that I'm doing as part of my PhD and as part of today's talk. Non-communicable diseases are very unequally distributed, both between countries when we look at developed and developing countries, but also within, so including the UK. We're finding ourselves facing an increasing number of health inequalities. And by health inequalities, we mean different health outcomes depending on different population groups to do with socioeconomic factors. So in short, the summary is the poorer you are, the more likely it is that you will develop one or more than one non-communicable diseases over your lifetime. And as such, they are considered to be unfair, because these conditions, it is believed, are largely preventable if we have the right policy approach in place. However, the problem currently is that the current policies that we do have are not enough to close the health inequality gap. So you might be wondering, as we've discussed, that non-communicable diseases are experienced differently by different social groups in society, and what that actually means about how much sugar is consumed between different social groups. And the answer is we don't really know. I mean, that sounds surprising, but the extent of inequality of sugar consumption is a hugely under-researched area. And there is very little data available that actually looks into this and that tracks over time how different groups in society consume sugar over prolonged periods of time. So extremely limited data is available. There is one study that we've come across, which is also in recognition of the fact that there just is hardly any available data on the equality of sugar in people's diets, has started to track some other surveys that have been done in the past. That was published a couple of years ago and has found, perhaps unsurprisingly, that indeed there is a clear social gradient of inequality between different social groups when it comes to the amounts of sugar that have been purchased. And that was the case for 18 out of 23 different food groups. And these food groups included quite a large list of items, but the biggest differences were noted when it came to soft drinks, table sugar, confectionery, and biscuits. And certainly the findings with regards to soft drinks have also been mirrored by other literature. So there's quite a lot of research that is available within the US and Australian context, because soft drinks are consumed largely by teenagers. So a lot of research has gone into this. And I have found the same link, which confirms that the more sugary drinks are consumed as income falls, so the poorer you are, the more likely it is that you will consume more soft drinks compared to your better off socioeconomic counterparts. I've also done recently a scoping review in light of the fact that we've also noticed that there are very few studies available that look into sugar consumption and health inequalities. And then the study that I did also looked at what prevention methods are available for public health. So what is being done at the moment to try and reduce sugar consumption and to do so in a fairly way. And in general, what we have found is that there are two options for public health policymakers. So option number one involves working with people on an individual level. So trying to use a high-risk strategy to identify people who are at a higher risk of becoming ill with a non-communicable disease. And the way that this might happen is, so for example, if somebody goes to the doctor or finds themselves in hospital, it is found that they might have high blood sugar, they might possibly be overweight or obese, and then an individual treatment plan is being put together. So this might involve follow-up with leaflets, with additional consultations. There might be referrals to weighing clinics or other consultations, all with the shared objective that for this one person, they're trying to reduce the risk factors and to attempt to reduce the risk of becoming more seriously ill with whichever disease they're having at the moment. The problem with this type of approach is that they're very expensive to run, and so it involves a lot of individuals who are coming together for one person. This is quite costly to do for health systems. That can be difficult to implement or difficult to do as a result of logistical issues or again budget reasons. Quite importantly, the success of them is not equally distributed or enjoyed. So again, we come back to the same finding that those who come from higher socioeconomic brackets tend to do better and achieve better health results afterwards, whereas those who come from the other end experience that less so. But most critically, the biggest problem about that type of approach is that it tends to be palliative. So the symptoms are managed but never cured, and it never gets to actually addressing the root of the problem, which is causing the disease in the first place. It's more a superficial case of managing the symptoms that emerge as a result of that. And what this type of approach links in is the neoliberal approach about health and framing health. So you might have come across this concept of personal responsibility for health. It's this belief that states that if we look after ourselves well enough, we will be rewarded with good health. And if we don't, then through intervention, there's ways to improve, and that should solve the problem. But in more recent decades, there has been much more awareness around the wider factors that influence a person's health and ability to stay healthy throughout their life. So this involves the social determinants of health. They refer to the conditions in part that we are born in and that we grow up in, that shape our dietary behavior, amongst many other things, which often we learn as we grow up and then continue as we get older. And these tend to be influenced by many factors which go far, far beyond this idea that personal responsibility is enough in order to enjoy a long and healthy life. So in recognition of this, there has been a shift towards some other policies which are meant to be universal. So the idea here is that these policies target everybody in society equally in order to reduce risk collectively. And this is done through a combination or through a selection of different policies, laws, or regulations. We often differentiate between soft measures and hard measures. So soft measures, for example, you might have come across this, the Change for Life campaign, which encourages people to eat better, move more, live longer in order to become healthier. The 5 a day is another gentle reminder to try and encourage people to increase the fruit and vegetable intake in their daily diet. What is on the other side of that spectrum is some harder approaches. So for example, the sugar tax is a good example of that. The sugar tax has been introduced in many countries around the world, including the UK, where it was implemented in 2018. And in general, the idea is quite simple. So by increasing the price of soft drinks that are high in sugar, people will go for cheaper options which have a lower sugar content. And the incentive for industry to avoid paying a tax is to reformulate their products, again, to go for lower sugar options in order to avoid paying the fine. And in theory, that sounds like a very good approach, but is it working? And again, it's not an easy, there's no straightforward answer here either. So there's two sides to this. Generally, from a health perspective, whether this comes from a public health body, for example, Public Health England or the World Health Organization, sugar taxes are being endorsed. They're seen as the best strategy to tackle obesity and other non-communicable diseases, including dental health. And there's some very encouraging reports that have come out that suggest that the sugar tax has revolutionized the industry, that sugary drinks now contain on average about 30% less sugar than they did before the sugar tax. And I did also read another report that suggested that every UK resident saves about 6,000 calories through soft drinks every year now since the sugar tax has been introduced. So there seems to be a lot of good stamina behind it. But it is also worth to look at the wider picture, which is that in the years leading up to the sugar tax, so way before 2018, we've started to see a pattern which showed that people's soft drink choices were declining slightly, so they were consuming less. There was a downward trend in terms of consumption patterns that started before the sugar tax was introduced and has carried on ever since. So the question whether the sugar tax on its own was enough to have a big impact or whether it would have happened anyway is somewhat debated. But also more importantly is that since 2018, obesity rates have not declined, they have instead increased quite dramatically. So we have had an increase in obesity, and more notably, we have not seen any improvements in health, which might be to do with the fact, certainly with regards to the obesity, that customers might have switched from previous choices, which might have been high sugar content soft drinks, down to other high calorie drinks. So for example, milkshakes, fruit juices, alcoholic drinks, and so on. So in total, we can say that a sugar tax helps to reduce sugar consumption to some extent, but on its own, without any additional policy support, is not enough to achieve sustainable health outcomes for the better. So before we all fall into a pit of doom and gloom that everything is lost, there are some other suggestions as to what could be done instead to achieve better and fairer health outcomes when it comes to diet. Since both approaches that we've discussed, so both more universal approaches such as the sugar tax and an individual intervention haven't achieved sort of the health benefits that were hoped for and also not managed to reduce health inequalities sufficiently, one solution is to merge the two to some extent. So to introduce a universal policy that still addresses whole populations together in order to reduce risk, but to also allow for some additional resources to be given to those who need them the most. So this might be a case of looking at certain geographic areas and to allocate additional finances to provide some more possibly community projects or other targeted interventions for those who are most vulnerable. As a trial to see these sorts of policies have been used or are being used in various countries, including Scandinavia, and are seen to be as being quite successful. Although there is also a question that in those countries there's generally slightly better funding available for health and social care. However, it still seems like a good and worthwhile policy to try. The second option that there is for public health policy to go beyond simply the health sector alone and to simultaneously also address other sectors So for example, this might be housing, this might be access to fresh food, to avoid food deserts. Some neighborhoods do not have any fresh food outlets available within a close proximity. So to do a multi-sector approach instead, which also includes health. And that, I think, brings me to my last slide. So to sum up, I hope that this presentation has been helpful to show that sugar consumption is a recognized dietary risk factor for the development of non-communicable diseases, which are a huge challenge for public health systems all around the world. They're also shared unfairly across different populations and shared unequally between countries. We do urgently need more research to know exactly what the extent of inequality of sugar intake is, as that's currently unknown. And we do not know how much it varies between different social groups, as there hasn't been any research done so far that has really looked into this and tracked it over time. The existing and prominent approaches in public health which try to change behavior either by working with individuals or with the population as a whole have their shortcomings and have most importantly been criticized for not being able to reduce health inequalities. Where there are new policies available, they do need to be trialed, and if they're not being trialed, then there is a risk that they might at some point be seen as becoming too problematic or too difficult to do because they haven't been done yet. So these seem to be critical in order to try and reduce health inequalities and sugar intake across all populations. And a lot of these points are to do with budgets and to do with money. And there are reports available at the moment. For example, the new health secretary, it has been reported that, for example, a long-standing paper that has been much anticipated about health inequalities might not be published after all. It was postponed for a little bit and we're still waiting for its publication, but there is a risk that it might not get published at all. And again, there are some critical findings in this, no doubt, that are worth being shared and discussed. And then we'll also have to see what happens with other proposals that would have limited certain new initiatives. For example, the buy one get one free offers on unhealthy choices in supermarkets. There's also some question marks now about whether these will materialize or not. So there's certainly a lot of interest in the topic of health inequalities, but we're waiting to see what happens. A lot of it is changing very fast depending on different political influences. But I hope that's been helpful to you. It's been really, really nice to be able to share this with you. And I think Peter and I are going to dive in the Q&A next.
Brilliant. Thank you, Bettina. And I'd just like to say the title of this series, Bright Minds, it's really good to see a bright mind at work. So a current PhD student at the University of Sheffield giving such a concise and fascinating presentation. So thank you very much. Okay, we're going to move to the Q&A now. And we've had, I think, more than 40 submitted questions. So we can't possibly answer them all. And if you've been keeping your eye on the chat, there's been lots more questions coming in there. What we've done is to pick up on the questions that we're best able to answer based on our expertise as social scientists. Some of you, particularly in the chat, have asked questions which are of a more medical or health science nature. And it's not fair for us to hazard a view on those topics if we don't have the expertise. So we're going to focus on questions which most closely relate to Bettina's PhD research and her own skills and expertise. And I'm keeping my eye on the chat as we go because there's some interesting discussion going on in there. Let me start though with a question that relates to what Bettina was saying in her conclusion there. And this is a question from Magnus Galli, who asks if Bettina has any reflections on Therese Coffey's first few weeks as Minister for Health. And he then asks a second follow-up question about whether the planning system could do more to reduce health inequalities. And I think he's thinking there about the location of schools and retail outlets. So Bettina, can you start with the Health Minister and then go on to the planning system?
Yeah, sure. So yes, the Health Minister has certainly had some eventful first weeks in office. I think the research that I've been looking at seems to suggest that universal policies, whether this is to do with food labelling or with trying to introduce different incentives, for example, ending the buy one get one free on certain unhealthy food options, they are definitely offering a lot of potential for people. They also need to be coinciding with other additional initiatives, but the fact that they're currently being possibly questioned as to whether they will happen at all is certainly possibly indicating that we're moving back to this, I don't know, policy making that is linked to personal responsibility, so that we're still trying to go back to the type of thinking that suggests that if we're just being responsible enough, then we don't need anyone to tell us what to do or what not to do. And that has been shown to be problematic and not lead to better health outcomes. So it will be interesting to see what happens there. I will watch with a little bit of hesitancy, but we will see how that goes. With regards to your question about town planning, yes, I think there is certainly a lot of scope there for town planners, because some neighbourhoods do really struggle to have access to fresh food, also fresh affordable food, which sometimes you only find in bigger supermarkets. And if these are not available for people to get to by foot or by public transport, then automatically that reduces somebody's options to have a healthy diet consisting of fresh nutrition. So there's definitely room for scope to try to encourage as many fresh food outlets in neighbourhoods as possible, also for town planners that often focus very heavily on squeezing in as much housing as possible, but to also allocate spaces for food shops like that are able to provide people with fresh nutrition.
Perfect, thank you. Okay, I'm now going to move to some of the questions that have been posed in the chat. And I'm going to try and roll 2 or 3 questions together. So Stephen Dixon asks the beguilingly simple question, why do poorer social groups consume more sugar-sweetened beverages? And the discussion took off then in the chat. So Sarah T suggested some possible answers. They're readily available, they're cheap, and they provide a quick energy boost. And then we had some discussion from Tim Collins, who asked about whether the McDonaldization of society and food in particular has contributed to increased sugar consumption. And Dr. Sujay Ghosh asked some questions about convenience food and so-called ultra-processed foods. So can we roll those together and see if we can think about the way in which different kinds of foods that have become more popular over the last couple of decades might have contributed to increased sugar consumption in general, and in particular those for poorer people living in poorer neighbourhoods?
Yeah, so thank you. I'm going to try to keep up with the questions, but there was some really interesting conversations going on there. I'm sorry, I missed it in the chat. I was busy talking. But yeah, why do poorer people consume more sugary drinks? And I think Sarah gave some really good pointers there. This also goes back to the point I was making earlier about food deserts. So if a corner shop is all you have available in your close neighborhood, then you're more likely to go there for picking up, I don't know, if you want a quick energy fix or a treat or anything at all, in light of the fact that you might not have other alternatives available to you within close proximity. So certainly the fact that they are very cheap a lot of the time, that they are a quick energy fix and that they are readily available, make them very appealing. I think there's also a different angle to this, which is to do with the role of the media and marketing, because we've all seen the Pepsi campaigns where like pop stars or other celebrities to walk around with a soft drink in their hand, so representing a lifestyle choice as well, rather than just a little snack choice. So it feeds into an image, and I think young people get to see that a lot now through social media, targeted advertising and so on. So we're exposed to a lot more subconscious marketing sometimes than we realize, and that includes food choices such as soft drinks. So there's complicated, multifaceted reasons as to why people from poorer backgrounds tend to consume more. Also a fact about the sugar tax is that it is in fact regressive. So people on lower incomes are hit by a sugar tax harder because it takes up a larger proportion of their income. So whether, we are yet to see whether this will actually make a meaningful difference over long term, but it does seem that where you live very much depends on how you eat and how you drink and what options you have available to you.
Great, thank you very much. I'll go back now to the submitted questions. Stephen Greif says, I live in High Wycombe, the food poverty black spot nationally, according to the report which the Institute for Sustainable Food, and Megan Blake in particular, did last summer. She says, is this topic, sugar consumption, something which has a similar distribution? geographically to food poverty. So this is not just about the incidence of sugar consumption by social groups, by education, by age, but asking, are there kind of geographical clusters or black spots?
The answer is, again, it's hard to find data, but yes, there is some clusters, and I think they're referred to as black spots some of the time in some of the literature. So certain areas in London, certain inner London areas tend to have very high sugar consumption rates. And then there's also in the north of England certain spots where, again, sugar consumption tends to be very high. I don't think we have enough research available that actually explains why, particularly in those areas, that is the case. It might be a case that small corner shops are located within the community in question, and that they're just a go-to choice for people to pick up their shopping. And again, having limited options available and limited fresh or healthy food choices available at cheaper prices, which you might find in a bigger supermarket, might push people into those choices a little bit more than they would have done otherwise. I think we also have to take into consideration the fact that the cost of food and drink is going up very quickly at the moment. So again, people who live in poorer neighbourhoods will feel that squeeze even more than anybody else. And again, that might push them towards cheap, sugary products, whether they're drinks or sugar that we eat in processed foods. So I'm assuming that there is a link between those issues, but at the moment we just don't have enough data to make some confident suggestions as to why it is more prominent in certain areas compared to others.
Yeah, I could just add to that. The best data on this is in the National Diet and Nutrition Survey, the NDNS, and they produced some nice maps which showed that there were concentrations in inner London boroughs and in some parts of northern cities like Leeds, Manchester and Liverpool. And they showed that there was almost an inverse set of maps about consumption of fresh fruit and vegetables. So there is some nice work on this kind of differential geography. Okay, let me press on then. Again, a pre-submitted question, this time from Chandrani Maitra, who asks about whether we can change what she calls the culture or the role of the media and the relationship between that and interventions in public policy and awareness raising.
So I was writing this down. So can we change the culture and the role of the media? Yes, I think, as mentioned before, I think it needs to be a combination of different factors that all come together and together try to achieve some awareness campaigns or some healthier food choices where that is possible for people. So through some of the awareness campaigns have been very effective. I think the Change for Life one has had a very good impact and has been received very well. That seems to have led to some good dietary swaps in people's daily food and drink choices. So that's certainly been a good contributing factor that probably needs to go hand in hand with some other initiatives that are happening around the same topic, just to be able to get through different age groups, different demographics, to make it fair and to make it accessible and to not put people off by being too prescriptive about it and too much going down the lecturing route of things. So to just be positive, encourage positive changes wherever that is possible. Can you remind me, Peter, what was the second part regarding intervention?
It was about the relationship between what I think we talk about. You talked about in the presentation about soft and harder measures. So the softer measures were what you've been talking about in terms of health campaigns or representations in the media and so on. But the harder measures would be taxation, fiscal measures, or regulations on advertising to children. So
yeah, and I think one finding that has come out of looking quite a lot into this whole concept of personal responsibility and blame is that shaming people by being particularly negative about somebody who's obese, or just trying to revert to stereotypical thinking as to what sort of things we think about people who are obese or in a bad shape of health, is that there needs to be more awareness that personal responsibility and this type of thinking that if we only tried harder we will be healthier is not enough to help people make better choices about their health, their food and their diet in general.
Great, thank you. We're getting through questions at quite a rate, so I'm pleased we won't get through them all, but we're doing well. So here's a question which is perfect for research material. It comes from the chat and it's from someone I only have their initials DGI. Why does Trinidad and Tobago have such high levels of sugar sweetened beverage consumption? Or countries like Trinidad, if we want to generalize.
Yeah, So again, that's a really interesting question, and it's one that we have been looking into for some time. So there are different reasons why we think that might be the case. So generally, the climate, I think, is one factor. So Trinidad and Tobago is a very hot, beautiful, hot Caribbean spot with very high temperatures. So to have a cool soft drink is quite a refreshing break and an easy fix that is quite affordable. Trinidad also has a very, very strong local soft drinks manufacturer. So they don't necessarily import all of the soft drinks from brands like Coke or Fanta, but they're being made locally, and there's quite a good system in place about where the bottles come from and what color drinks people prefer. So there's different ethnic groups in Trinidad, and it turns out that some ethnic groups prefer a particular type of soft drink, whereas others prefer a different make. And these are being produced locally and with glass bottles, recyclable bottles. So there's quite a cultural attachment to those as well. I think it's something that people just do to express how they feel about themselves. And again, there's possibly not enough awareness over quite how much sugar is in them, because people have grown up with them. They've always been there. They're quite a strong local cultural presence in Trinidad. So to change people's attitudes around them is something that will require, again, I think, a multi-layered approach from public health that works together with the food industry to some extent, because the food and drinks industry in Trinidad is very powerful and is a very dominant local player. So to get them on board with any campaigns like that seems critical, but requires quite a lot of diplomatic negotiating.
Good, thank you very much. A question again from the chat was about, can we learn anything from the cessation, the restrictions on smoking that might be relevant to the reduction of sugar-sweetened beverages? And there's obviously been specific legislation about consumption in public places. There's been health campaigning going on. And I think I would argue there was a lot of kind of preparatory work before the legislation was introduced. But Bettina, what are your thoughts on that?
Yeah, again, it's a good question, because the smoking campaign seems to have made quite a positive impact with regards to reducing smoking over time, certainly now with younger generations. So I have seen some of the examples of what food labels might look like, some of the proposals. And there's different options that have been designed, and none of them have been approved yet. But I do think some of those would actually be helpful, because they do break down, so they're quite large. The packaging is very clear, and it tells you, for example, how many minutes of exercise, or particular exercise you would have to do to burn off whatever sugary product it is that you're consuming. And I wonder, because some of the existing food labels, it might not be quite so clear quite how much sugar they contain. So to do some awareness campaigning around that would probably be helpful to try to implement some changes subtly, but possibly efficiently. With the whole difficult with looking at how soft drinks are perceived by the public, because we do, I think, want to stay away from shaming people about their choices. So it's trying to make positive changes, or encouraging positive changes. So moving towards the benefits rather than talking too much about how bad it is if you do a thing every now and then. So there might be at some point possibly some more awareness campaigns that try to tackle that amongst young people, I would have thought. I know that in schools they're being quite strict now about only allowing in certain drinks, and about vending machines not being as available everywhere as they used to be, certainly when I was growing up. So there are some changes that are coming, and they will eventually, we'll see how cumulatively that will impact on people's consumption habits.
Good, thank you. Okay, I'm going to roll another couple of questions together now. One which was submitted in advance by Emma Bailey about sugar substitutes of the kind that are used in diet drinks. Are they better for us than sugar? And then she raises some questions about possible health scares around cancer. And then in the chat, we've just got a question from Sally Remedios. What are the health effects of artificial sweeteners? So artificial sweeteners, sugar substitutes versus sugar.
Yeah, again, Emma, that's a really good question. The sugar substitutes, they do help in reducing people's sugar intake, but my understanding from what I have from the research I've done on sugar, on soft drinks, is that they don't lead to better health outcomes either. I think there was some scares to do with aspartame, so the sweetener that goes into many soft drinks. about that being a particular contributing factor for developing cancer. I believe, as far as I know, that has been disproven. But I did also read something else recently that suggested that some of the sugar alternatives, including sweeteners, do not contribute to better health outcomes either. So it seems to be a case that it might not be worse for you, but whether it's actually better for you is also not quite proven.
Okay, good. Thank you very much. There's a question here from Camilla Poppleton about the strains that high sugar consumption and links to diabetes, links to obesity might cause on the health service.
Yes, so I think I have a figure here from how much the obesity costs the NHS every year. Peter, you probably remember it better than me, but I think it's about 4.2 million every year at the moment that the NHS spends on obesity-related diseases. So there clearly is, and this figure is only increasing. So it's at the moment, and we're not seeing anything that's actually helping to bring that down. So there's certainly increasing pressure coming on the health system. And I guess another concern is that with the current cost of living crisis and the fact that healthy food is also becoming more and more expensive, that obesity numbers will unlikely to improve as a result of the current conditions that we're living through. So yes, obesity is certainly closely linked with sugar consumption and poor health. And I think the predictions are that if things continue as they are, which we don't know yet, we'll see that it will just increase in terms of how much burden it is on the NHS and other health systems in other places. Yeah,
some figures suggest that the costs to the health service might double within a single generation, which is a worrying thought. Several questions in the chat about school meals and interventions that might help children in poorer neighbourhoods. There's lots of work going on in our H3 project about this, but are suggestions that cuts in local authority budgets may reduce the quality of school meals, may encourage them to use more convenience foods high in sugar, fats and salt. Anything in your systematic review that links to that?
So we haven't looked at school meals, but they do also, I think a lot of schools have lost their own kitchens, so are not importing their food, and inevitably that means that a lot of these are ultra-processed foods and ready meals. So I would also, I don't know the numbers on the nutritional content of them, but it doesn't seem impossible that they might also be reformulated in light of current budget cuts and issues to do with food costs. So that might not necessarily change for the better. But I think certainly in secondary schools, there seem to be more initiatives now to try and introduce healthier food in canteens, which traditionally I think is just the usual options of pizzas and burgers and so on. So there's some more awareness campaigns, certainly where I live now, that's trying to push schools into offering some more healthier, less processed options. But whether that will actually come is a different question.
I have to ask this next question because it's from one of my former students. Hi Mauro. So the question is from Mauro Cruz Mercado, and he's interested in the role of sugar labelling in Trinidad specifically, but I think more generally. We know lots about kind of traffic light systems and so on. So what is the evidence on food labelling in general, but in relation to sugar more specifically?
That's a good question. I'm afraid I'm not sure I can answer it. I know that in Trinidad, food labelling has not been done yet, but that is well on the cards. That is being discussed together with a sugar tax. So that again have been discussing the sugar tax for a long time, and it hasn't materialised yet. Same for food labels. With regards to the existing labels that we have here, the research that I've looked at suggests that they're not being particularly clear. And then there's the question, is the food industry perhaps being deliberately unclear with their food labels to possibly make them look less worrying than they are when we actually realise how much sugar is in the products that we consume. It's also easy to look the other way, as I know from myself too. But to what extent the current ones are effective, I'm not sure. But I think the newer ones that I've seen that were being discussed, this was previous change of government, they were certainly looking a lot clearer, and I'm wondering if they would possibly make a difference if they were being implemented, because they did seem to bring the message across much better as to how much sugar was in it. They were much bigger to read as well, so the numbers made sense, and they were being equated to exercise and how much in a day you could then have in addition to that particular item. So we'll see what happens with them.
Yeah, thank you. There's been a helpful comment in the chat while you've been speaking from Carol. Sugar and other nutritional labelling has been on food since the 1980s. Little evidence this information is read, maybe only reaches the worried well, and so on. And I think that's a general point, isn't it? There is so much emphasis now on food labelling for nutrition, for environmental impact, food quality, provenance, and so on, that it kind of assumes that consumers have unlimited time to read and digest the information on labels. And if you look at most of us as we run around the supermarket on a Saturday morning with children in hand and so on, that some of that information is there to put pressure on other food businesses rather than as something that consumers routinely would use. What else? So I'm trying to read things as I go. Let me just go to a question that Gwen asked in the questions that were submitted earlier. She says she works in a food pantry and is very concerned about issues such as food waste. She wants to know what people in her situation running emergency food aid or food banks or food pantries might do to reduce sugar consumption.
Yeah, again, food banks are doing amazing work, and they're going to be more in demand possibly than there have been in the past going into this winter. So there are some possibilities, depending on where you are, depending on your location. If there is a fresh food outlet or a fresh food shop, whether this is a farm shop or something else, to ask directly for donations of some fresh produce. So this might be fruit or vegetables, something that might not necessarily need to be refrigerated. There is obviously then the issue of food waste. But if you're getting a donation from a shop like that, there is a risk that they would have thrown it out anyway. So you might not be causing additional food waste by doing so and by asking for additional donations like that. I do know that there are some initiatives for farm shops and food banks have teamed up recently. There's also various apps that are being used now. I've come across a couple between neighborhoods about donations or collecting donations from particular households or from smaller shops that would have not included delivery stops to food banks before, but there's some schemes being set up between people, and so there's opportunities like that. I think, Peter, is there anything you can add to that?
Briefly, I could add to that, yeah. So the H3 project that I'm involved in, led here from the University of Sheffield, worked with colleagues in Leeds to do a health audit of the food that FareShare provides and other charities. And part of that was what Bettina was saying, that they're reliant on donations, and you're more likely to get donations of tinned and packaged goods than fruit and vegetables. If you have fresh fruit and vegetables, there are issues of food safety, there are issues of food waste, and so on. So food banks and food charities do a fabulous job, but they're limited by what donations there are. Donations are going down given the current cost of living crisis. And I don't know if you said this, Bettina, I was so busy reading the chat, but my line on this would be, we shouldn't need emergency food aid in a country like the UK, and we should think of food more as a right than as a charitable donation. But perhaps that's just my personal and political views coming in here. I think we only have time for a couple more questions. There's been quite a few interesting questions about cultural tastes and variations. I think going back to those sort of, why is it concentrated in northern cities and in eastern in the East End of London and so on. And there was a comment here which I've lost, but I'm desperately trying to find, about how particularly different ethnic minority communities might have different tastes for very sweet confectionery and so on. And does that help explain this? And if it does, what do we do in terms of policies that apply across the UK to take into account those kind of cultural, social and ethnic varieties in people's diets and tastes?
Yeah, that's a good question. And when I was doing my research on soft drinks and looking at the different reasons as to why people consume that many soft drinks these days. The family environment has come up from the reading that I've done as the most prominent factor that influences young people's choices when it comes to soft drinks and other sugary products. And if the family culture, because it tends to get passed on from one generation to the next, tends to be one that includes a lot of sugar in their diet or with their meals, then it is likely that that will then also feature in the children's perception of what mealtime looks like, what snack time looks like. And I think this is part of the idea of some of the, like one of the policy approaches that are being suggested as a step forward is to include some targeted interventions. So to try and find ways for population groups that need a little bit more support with making transitions, such as moving from a high sugar to a possibly less high sugar diet, and find ways that are culturally appropriate, that do not go down the shaming route, that encourage healthy swaps in a way that is appropriate to that particular group, and that would require looking at what these particular needs are and how they could be best addressed in order to try and shift some of those habits for better health outcomes.
Okay, I think this had better be my last question then, and it comes from Nazim Haji, and it asks, I think it's a nice question because it links the work you're proposing to do in Trinidad with the work you've been doing mostly in the UK. Does the first world, as he puts it, does the first world care about food security and sustainability in the third world?
I really want to say yes. This is my personal opinion, possibly more than a more general opinion. So I know, being part of the research centre that I work for, I know that there's research proposals that are particularly looking at the developing world and third world countries, and trying to look at all sorts of different contexts as to providing sustainable solutions for existing serious problems. So my own research looks at Trinidad, which officially is a developed country. It's made that transition in a couple of years ago, but in some ways still also isn't too far removed from being a developing country. So that's also been part of my interest, to look at a country like that is still in a transition phase and has got different needs to some developed countries, in order to find out solutions that could be of benefit to that place, to this place in particular. But I think there is ongoing research that looks into this, but if we look at a more structured government level, I think it's less easy to see where things are heading at the moment.
Yeah, thank you very much. Okay, so I just say again, there's lots of research going on here at the University of Sheffield that does make links between the global north and the global south. Research by Bhavani Shankar, for example, on stunting among children in poorer parts of India and elsewhere. So there are reasons to be cheerful there, but I think some of the recent policy decisions cancelling the Global Challenges Research Fund means there might be less of this kind of research in the future, and that, to my mind, would be a great shame. Okay, I've overrun my allotted time by a couple of minutes, but as you've seen, there have been some great questions, and well done, Bettina, for fielding such a diverse range of questions. As you've seen in the comments, the chat has been extremely lively, people answering each other's questions. My comment about food banks seems to have generated a bit of a storm in the chat as well. So I'll hand back to Andrew to say a general word of thanks, but can I thank our bright mind for the evening, Bettina, for such a terrific presentation. Thank you.
Indeed, thank you, Peter. And Bettina, thank you very, very much indeed for insight into some fascinating research there. And Peter, thank you for a great opening and a wonderful facilitation of that Q&A. As Peter said at the opening, we weren't able to get through all of the questions, and we knew that. And we do have some great health sciences academics at the university as well, who could answer potentially some of your questions. If you do have questions you want us to answer, please do email us at alumni@sheffield.ac.uk. That's alumni@sheffield.ac.uk, and we'll see what questions we're able to answer. If you'd like to watch the previous webinars, if you want to rewatch this one, which will be up next week, please do visit our Bright Minds web pages, and a link will be shared with you in an email that we'll send out post this event. Thank you very much once again to Bettina, to Peter, and for all of you for joining us this evening. And wherever you are in the world, you know, whether it's morning, afternoon, or evening, we wish you a great rest of the day. Thank you very, very much indeed. Thank you.